Upon signing into MedTrak, the MedTrak main menu appears. On this menu are the major categories of functionality included in MedTrak. I am only going to point out the functions that will be in this video. The Clinic Status option displays a real-time workflow view of the medical facility where all of the clinical documentation activity occurs. The Patient Registration option begins the in-clinic workflow processing. The Scheduler option is for keeping track of patient appointments and managing the provider's schedules. The Billing option encompasses all functionality related to billing, including tracking unbilled charges, creating bills, posting payments, managing accounts receivable, and logging collection activities. For this demonstration video, I will be wearing several hats. First, I will wear my administrative hat and use the scheduling system to set up an appointment for an established patient. To access the scheduling system, I click the Scheduling button on the main menu. The initial scheduling screen displays that location's schedule for the current day. Each scheduling line is based on a time increment that the location uses for the scheduling of each appointment. The MedTrak scheduler uses a three-tier location structure that I access by clicking the Location button at the top of the screen. The first level is the location level. This level is used to define the physical location of the clinic. The second level is the division level that identifies the departments within the clinic. For example, in this location, there is only an injury-illness division. The third level is the staff level that identifies which physicians and specialists work in that division. To select the staff member's schedule, I click the staff member's name. MedTrak resets the scheduling screen to the selected staff member's schedule. The scheduling screen allows resetting the schedule to any date that the provider is available to see patients. I can use the Next Day button to move forward one day at a time. Or I can type in the date field the date that I want and press the Enter key. Or I can click the calendar icon and select the date from the calendar. For this example, I am going to leave the calendar on the current date. Matrixing the schedule is done by using the Blockout Time function. To block out time in the schedule for Dr. Abel to attend an outside meeting between 8 and 9 a.m., I place the cursor in the 8 a.m. time field and click the Blockout Time button. After entering the ending time for the block and the reason for the block, I click the Submit button. MedTrak automatically returns to the scheduling screen showing the blocked out time. If this meeting was then canceled, I can clear the block time frame by using the Clear Block button. To schedule an appointment for today at 3 p.m. for Janice Cooper to see Dr. Abel for left ankle pain, I place the cursor in the command field next to 3 p.m. and click the Add Appointment button. For this example, Janice is already in the patient database, so I place the cursor in the command field next to Janice and click the Select button. MedTrak is set up to process patient responsibility cases where the patient or their group health insurance is responsible for paying for the visits, and occupational medicine cases where the employer or their work comp carrier is responsible for paying for the visits. Janice hurt her ankle while walking down some steps at home, so I place the cursor in the command field next to patient responsibility and click the Select button. At Janice's last visit, she had group health insurance with Assurant Health. I confirm that she still has coverage with Assurant and remind her to bring her current insurance card and photo ID with her. On the Add Appointment screen, I enter the reason for the appointment of left ankle pain and set the length of the appointment to be 30 minutes based on the provider's appointment length schedule of 30 minutes for an initial injury appointment. After clicking the Submit button, the appointment note screen appears. I enter that she injured her left ankle while walking down some steps and click the Submit Note button. MedTrak automatically returns to the scheduling screen showing the new appointment for Janice. The asterisk in front of her name indicates that there is a note attached to this appointment. We have a lot more ground to cover in this brief demo, so I'm out of time to show more of MedTrak's scheduling features. Now I'm going to put on my front desk hat and register a patient. MedTrak allows patient registration in two ways. For walk-in patients, the front desk uses the patient registration process. For scheduled patients, the front desk can register the patient directly from the scheduling screen. In this example, I will register Janice Cooper, the patient that we scheduled earlier. Janice approaches the front desk, tells me her name, and indicates that she has a scheduled appointment. I switch to the scheduling screen to look for Janice. On the scheduling screen, I place the cursor next to Janice and click the Patient Showed button. On the New Case screen, I enter her chief complaint as left ankle pain. Janice's payer screen appears. After scanning her insurance card and photo ID, I verify her insurance information. The Visit Ad screen appears for me to select the type of provider visit. In this example, she is here to see the doctor. This screen also reminds me that the payer requires a $25 copayment, which I will collect at discharge. MedTrak is a rules-based system that is problem-focused, and the front desk selects the patient's presenting problems. For Janice, on the presenting problem screen, I select an injury to the bones, and then on the body part selection screen, I select left ankle. Front desk registration for Janice is done, and she now appears on the clinic status screen ready for the clinical staff. I return to the scheduling screen, and Janice now has an equal sign in front of her name indicating that she showed up for her appointment. Now let's move to the back examination area for clinical processing. Once a patient is registered, they appear on the clinic status screen. The clinic status screen displays a real-time workflow view of the medical facility. Each member of the clinical staff uses this screen to access their portion of the documentation screens for the clinical care of the patients. The clinical team can use wireless touchscreen devices such as laptop computers or tablets like an iPad or desktop computers strategically located for their documentation purposes. This column represents the rooms that are in the medical facility. There are 6 exam rooms in this facility. This column contains the names of the patients that are currently in the medical facility. This column represents the orders and whether there are open orders or the open orders are done. This is the workflow status column representing the next step in the workflow of this patient. This column representing doctor, tech, clerical, x-ray, lab, rehab services. These columns represent the times and minutes that we were waiting for the next workflow step for the patient. So this patient, Linda Hughes, is done. They're back at the front desk ready to pay for their visit, and they've been waiting for the clerical staff to finish doing that for the last 8 minutes. These 3 patients are waiting for rooms, including the patient that we registered from the scheduling screen 7 minutes ago. In room 3, Thomas Gordon's is waiting for the nurse to answer nursing notes and been waiting for 6 minutes. In room 4, Elise Green's chart is in the rack waiting for the doctor to pick up the chart for 7 minutes. The doctor went in room 5 7 minutes ago and is examining that patient. And in room 6, we have an open order for the tech for 5 minutes. This column and this column represent the last tech and the last doc to see the patient at this visit. And in the last column represents the total elapsed time that the patient's been in the medical facility. Now I am putting on my clinical staff hat. After registration, patients wait in the reception area for the clinical staff to place them into an examination room and ask them some preliminary questions prior to the physician seeing them. To move Janice into a room, I place the cursor next to Janice and click the Room button. Once the clinical staff places the patient in a room, they ask the patient questions about their reason for visiting the medical facility, including questions about the patient's medical history, medication history, allergies, and record the patient's vital signs. After verifying the accuracy of the presenting problem is captured by the front desk, the clinical staff answers the nursing questions. MedTrak's clinical decision support function problem focuses the nursing questions to the presenting problem. Each answer field on this screen allows up to 10 characters. If the answer is longer than 10 characters, the clinical staff uses the expanded answer function to answer the question. on this screen, they can actually turn on voice recognition and dictate directly into this field. Many questions have standard answers to them that can be answered using a trigger to drive a stored response. For instance, if the pain scale was 5 out of 10, I can put a 5 in this answer field, press the enter key, and it'll bring back the answer of 5 out of 10. Medication allergies, let's say there aren't any. I can type a little N and hit and now I have none. After entering answers to the nursing questions, the nurse lets the doctor know that the patient is ready to be seen by placing the chart in the rack. The clinic status screen now shows that Janice's chart is in the rack and the workflow time has been reset for the doctor to 0. Chart's in the rack, doctor time is at 0, the meter's ticking. Now I am going to put on the doctor hat for just a moment to place a couple of orders for Janice. The doctor lets the staff know that they are examining the patient by clicking the Examine Patient button. The doctor time is now reset to 0. The workflow status is examined. Prior to going into the room, the doctor can review the nursing notes in the online chart. While examining the patient, the doctor can use the problem-focused CPOE to place orders for the patient. In this example, the doctor is going to place an order for an X-ray of the left ankle, so we'll do a 3-view. Additionally, the doctor is going to place an order for an ice pack to help reduce the swelling on the patient's ankle. Again, the problem-focused system enabled the doctor to do this in just a couple of clicks of the mouse. The clinical staff sees that there are open orders for Janice and clicks the Open Orders button to see what they are. This shows the tech that they need to provide an ice pack for the patient. X-ray department needs to do a 3-view X-ray on the left ankle of this patient. This shows the patient's name at the top and that the patient is in room 2. Once they document this information, the clinic status screen automatically refreshes, showing that there's still open orders, but the tech time is 0, the X-ray time is 0. It's now back into the doctor's column, and the reason for that is if you click on the open orders, it's now the workflow is handed back to the doctor for them to do the initial impression on the X-ray. In this brief demonstration, we will not be covering the additional clinical documentation steps for this patient, which includes additional orders, referrals, diagnosing, documentation of the history and exam by the physician, prescribing, patient aftercare instructions, selecting the level of service. Now I will put my front desk hat back on and process the payment from a patient. When the clinical staff is done treating the patient, if the patient needs to make a payment related to the visit, they are sent back to the front desk to make the payment. The Done screen shows the total of the charges for the visit, the amount of co-payment and/or co-insurance that is due from the patient, and the total that will be billed to the group health carrier. I record the patient's check for $25. Then it's a check. Source is payment. I put the check number in. The clinic status screen automatically refreshes, and because this patient's clinical processing is done and they've made their payment at the front desk, they are not on the clinic status screen anymore.